Well, good afternoon, my dear friends. For those of you who are wondering as to who am I and what was I doing in that Darth Vader kind of outfit, this is called as a respirator. It's a reusable respirator. And I'm a dentist. My name is Dr. Mayank Kaurani. And this is how your dentists are going to look like in future. And I'm not talking about far future, but I'm talking about immediate future. Once we open up completely and we start working in the clinics. Well, dentistry, dentists, medical doctors, and governments were caught unawares as far as COVID-19 has been concerned. We were caught with our pants down, so to speak. We had no idea about how to challenge this issue. We were expecting that things would become better and the disease would abate by a couple of lockdowns, but that has not happened. So here we are after in the fag end of COVID 3.0 lockdown and looking at COVID 4.0 lockdown going on. How are things going to be? Things are going to be a little difficult now that the lockdowns are being, restrictions are being eased, and there'll be a far greater movement of people. Offices are going to open. There's going to be a lot of interpersonal contact with people amongst themselves. Factories will open up. Markets will open up. Your supply chain would get reestablished. So what you're basically talking about and what you're actually looking at is that there will be a massive movement, influx of people, workers, interactions. And now that we know that SARS-CoV-2, which is the causative virus of COVID-19 disease, does tend to spread when there is human-to-human contact. And that has got massive implications for dentistry and dental patients alike. The patients, from the patient's point of view, you'll have to change how you approach your dentist for therapy. I believe now it is going to be just dental treatment by appointments. Things are going to become expensive because we'll have to use gadgets like these respirators, which come quite expensive, and we would be forced to wear those white-colored protective suits that you might have seen on televisions, which are called as coveralls. We would have to bring in place certain system checks for preventive aspects, for taking care of the aerosol that gets generated. When a dentist works in your mouth with a drill, they produce all of that aerosol. So all that is going to need to be tackled because, if there is by any chance a corona positive patient who walks into a clinic doesn't have symptoms, then we wouldn't know how to diagnose those patients because they are asymptomatic, and then the threat of spread of disease comes in. So we'll have to take universal precautions. And when you're talking about taking universal precautions for spread of any communicable disease, then you're looking at extra budgetary expenditures. Dentistry is going to definitely become far more expensive than what it is now. Are we going to get through this? Yes, definitely we will get through this. We have the resources to work it through, and and it's also about the willpower of the people. Indians are a very resilient lot, and I think we'll get through with it. Touch wood, the COVID-19 is not as severe as it has been in the rest of the world. Indians have been spared to a large degree. How do we look at it from a future perspective? Well, I think every dark cloud has a silver lining, and fortunately enough, dentistry is going to become better. Dentists are going to become better. Dental treatments are going to become better, and hygiene is going to become of utmost priority. Yes, some of the dentists are going to get wiped out. They may be waylaid. They may become non-functional because for whatever reasons. But then yes, things are going to change, and it's going to be better. Things are going to become better, and I feel that you as patients are going to be now center stage. Your welfare is going to be center stage, and treatment would not just consist of dental treatment, but would consist of keeping you in the center and designing therapy around your well-being, keeping in mind that we shouldn't be spreading any disease for you people. So yes, we have our fingers crossed, and good times are probably up ahead. And I wish you all the best, and I wish you great health. Thank you.